The committee will come to order. Without objection, the Chair is authorized to declare a recess of the committee at any time. The Oversight Committee exists to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. It is our job to work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. Over the past 4 years, the Oversight and Government Reform Committee has conducted vigorous oversight of the implementation of the Affordable Care Act, often called Obamacare, including the design and launch of healthcare.gov. Today, the committee focuses on the interconnected issues of security of the website, accountability within the administration, and most of all, transparency to the American people. The Government Accountability Office released a report this week on security of healthcare.gov. The GAO found the administration failed to take appropriate and sufficient steps to protect healthcare.gov and associated systems against security and privacy risks. More importantly, the GAO report strongly asserts that security testing is not complete and security weaknesses continue to plague the website. One of the principal authors of the GAO report will testify before us today. The committee has released a report detailing several breakdowns in both accountability within the administration and transparency to the American people during the design and implementation of healthcare.gov. It is important to understand that with private sector high-profile losses of information due to hackers, there are huge repercussions to those companies, and the government often comes in and further victimizes the companies who have in fact been victimized by hackers. And yet, when the government fails to protect involuntarily taken personally identifiable information, there is nobody but people on this dais to try to hold government accountable. Documents obtained by this committee show factions developed within the agency in charge of implementing Obamacare, the Center for Medicare and Medicaid Services, or CMS. These factions fought over several issues, including over website security. CMS often fought to keep information from their colleagues within the larger Department of Health and Human Services, and additionally, the administration endeavored to keep the truth and the true nature of the website's problems out of the public eye. Following the collapse of healthcare.gov, administration officials refused to admit to the public that the website was not on track to launch without significant functionality problems and substantial security risks. Last month, CMS denied the Associated Press access to security documents requested under the Freedom of Information Act. Even more recently, CMS refused to provide the Government Accountability Office documents related to the 13 incidents that we are going to hear about in vague detail here today. I want to make something very clear. Refusal to cooperate with the GAO, a nonpartisan government-created entity, refusal to allow access by the whistleblowers under Freedom of Information Act, and refusal to cooperate with even the Inspectors General, something we saw here just a few days ago with 47 Inspector Generals out of 73 complaining with the lack of access even within the executive branch. This is not the most transparent administration in history, and certainly the transparency we see here today was only done under subpoena. We will probably hear today that CMS has offered to brief GAO on these 13 incidents. It is not acceptable after the public scrutiny reveals that they exist and they've been denied, on the eve of a hearing and only after an audit is completed, to then say, we'd be glad to brief you. That's unacceptable and, quite frankly, one of the most disingenuous things I've ever seen. There were 5 months during the audit to comply with a reasonable request by the General Accountability Office, and it wasn't done. Questions of security can no longer be easily dismissed by the Administration. In late July, healthcare.gov suffered a malicious attack from a hacker, and it took nearly 2 months for CMS to identify the intrusion. CMS Administrator Marilyn Tavenner, who is with us today, will testify, and we will discuss that in addition to the GAO report. I'm sure we will hear that there was no loss of data, that this was not the main site, and so on. That doesn't change the fact that security risk exists whenever you fail to secure not just the main site, but back doors. Too often, back doors have been what we've discovered. In the case of another investigation of this committee, we discovered that the back doors were something as simple, in one case, as a stolen laptop on which those who stole it later added peer-to-peer software, which then made information on that database available to the public potentially. The Federal Trade Commission opened an investigation, and a plaintiff's trial lawyer sued and won money on behalf of people whose information was never actually released, but in fact, both the government and plaintiffs' bars thoroughly enjoyed going after a nonprofit AIDS clinic. I cannot and will not allow our government to put itself at a different standard of accountability. Last month, the Center for Medicare and Medicaid Services informed the committee that once again there were lost emails responsive to the committee's subpoena and documents relative to healthcare.gov. This is not an uncommon pattern. This is a pattern of predictability. This Administration has not complied with nor caused their key executives, including political appointees, to comply with the Federal Records Act. Administrator Tavenner admitted to deleting her own emails during the time period of Obamacare implementation. Madam, your actions hinder Congress's investigation and also prevent the public from accessing information under the Freedom of Information Act. It appears as though this Administration holds itself to a different level of compliance with historic Federal documents than the last Administration or any Administration since the passage. We are also today joined by the Department of Homeland Security's U.S. Computer Emergency Readiness Team, or CERT. The committee has concerns about the team's transparency regarding hack reported earlier this month. The Administration has already spent $1 billion on a website that is still not fully operational and fully not secure. The same government officials responsible for the lack of transparency and accountability a year ago remain in the position of authority. Questions of security, accountability, and transparency go beyond whether or not you support the President's health care law. Many of these issues are not limited to health care and mirror the transparency and accountability concerns raised again by 47 out of 73 Inspector Generals in an unprecedented letter to this and other committees of Congress in August. Minutes before HHS announced publicly on September 4th that healthcare.gov had experienced a malicious attack in July of this year, an HHS official contacted my office to give them limited details of the successful hack. During the brief call, HHS gave my staff the name and phone number of a contact at the Department of Homeland Security and suggested my staff contact DHS for more information about the hack itself and the government's response to the hack. My staff reached out to HHS's suggested contact at DHS on Monday of last week, followed up on Tuesday, and were told that DHS was running, and parentheses the request, back with HHS to see if we can all jointly get on the phone seeing if tomorrow will work. However, my staff followed up on Wednesday and Friday, and then on Monday and Tuesday with no response from DHS. I would like to note that despite a week of persistent emails from my staff, DHS was unable to make time to brief our committee even by phone. However, 2 days ago, the minority staff notified me that they were asking for our witness today, DHS, to appear as a witness at today's hearing. I accepted it, even though clearly this is a witness from an organization that has refused to answer questions or cooperate with the investigation. When the minority staff reached out to ask if DHS would appear as a witness, DHS was able to produce a witness prepared apparently in detail to provide testimony before this hearing today. However, DHS has still not arranged to properly brief our staff or to answer questions that we will be asking here today. I would like to introduce into the record at this time the correspondence between the staff and DHS as an example of what appears to be a very different treatment from this administration to a request from the majority staff versus a request from the minority staff. Without objection, it will be placed in the record. Let's cut to the chase. I have with me 3 witnesses. 2 very clearly are not part of transparency in government. I have no doubt that your organizations have worked diligently with the minority to try to make this hearing good for you. It is not our job to try to make this hearing bad for you, but the American people deserve the truth, not a cozy relationship between the people of your President's party in covering up the ongoing failure to secure a website that cost over $1 billion. And with that, I am pleased to recognize the ranking member for his opening statement.
Thank you very much, Mr. Chairman. First of all, I want to apologize for running late. The Speaker asked us to be at a joint session of Congress to hear the President of Ukraine, and many of us were there. One of our most important jobs in Congress is to help protect the interests of the American people. They demand that government and private companies safeguard their personal information, safeguard their Social Security numbers, their credit cards, and their health information. Nobody wants to get a call from a credit card company saying your personal information has been compromised. It can upend your entire life, and it can cause serious financial problems for years. I believe our committee has the potential to perform a very valuable function in this area. With our extremely broad jurisdiction over multiple Federal agencies and corporate entities, we can help promote robust security standards across the entire government and private sector. To date, however, we have not fulfilled this potential. Today's hearing is our 29th on the Affordable Care Act and our 6th on healthcare.gov. I completely agree that the ACA website must be secure. That is why I am so heartened that despite all of the challenges with the rollout last year, nobody's personal information has been compromised to date as a result of a malicious attack. Nobody's personal information has been compromised to date as a result of a malicious attack. Now, that could change, so we have to remain vigilant. After all, this is our watch. But so far, no attacks have been successful in that regard. There certainly have been attempts. Last week, the Centers for Medicare and Medicaid Services reported that hackers uploaded malware onto a server. But there are several key facts to know about the attack. First, it was not directed at healthcare.gov alone, but a much wider universe of targets. Second, the server that was attacked was a test server that had no personal information on it. Third, the most important, nobody's personal information was compromised as a result. That incident was investigated by the United States Computer Emergency Readiness Team at the Department of Homeland Security. The director of that team, in her written testimony for today, reports, and I quote, "There is no indication that any data was compromised as a result of this intrusion," end of quote. Although our committee has spent a tremendous amount of time focusing on the Affordable Care Act and its website, where no cyber attacks have compromised anyone's personal information to date, we've been disregarding much more serious attacks that have actually compromised a massive amount of personal information of our constituents. We are talking about hundreds of millions of people, hundreds of millions. For example, on January 14th, more than 8 months ago, I sent a letter requesting a bipartisan hearing with senior officials from Target. As I wrote, up to 110 million Americans were subjected to one of the most massive information technology breaches in history when their credit, debit, and other personal information reportedly was compromised, end of quote. On September 9th, I sent a letter requesting a bipartisan hearing on a major data security breach at Community Health Systems, the nation's largest for-profit hospital chain. I explained that, quote, hackers broke into its computers and stole data on 4.5 million patients, end of quote. As I noted, this was, quote, the largest hacking-related health information breach ever reported, end of quote. On September 11th, I sent a letter requesting a bipartisan hearing to examine the recent security breach at Home Depot, where our constituents shop. I explained that Home Depot, quote, has more stores in the United States and a higher total annual sales volume than Target, end of quote. And, quote, it appears to have experienced a data security breach for a longer period of time than the data security breach that occurred at Target, end of quote. And just this Monday, I sent a letter requesting a deposition with the CEO of USIS, the company that conducts more background checks for the government than any other contractor, and which had its own breach this summer. And I wrote, and I quote, although press accounts have reported that the attack may have compromised the personal information of up to 27,000 federal employees, government cybersecurity experts now believe this number is a floor, not a ceiling, end of quote. I'm talking about the people who work on Capitol Hill. I'm talking about the people who work for the federal government, up to possibly 27,000. In response, I received a letter back from the chairman yesterday, thanking me for my requests over the past year and acknowledging, and I quote, these serious incidents merit further review, end of quote. Chairman, I thank you for that. I hope we can start on this right away. After all, these are our constituents. Let me close by highlighting that this is much broader than healthcare.gov, much broader. GO, which is also represented here today, warns that the number of cyber attacks is increasing against targets across the federal government. And obviously the same is true of the private sector. So oversight is certainly called for, and I hope that our committee seizes the opportunity and rises to the challenge. With that, I yield back.
I thank the gentleman. At this time, I'd like to place in the record examples of State Attorney General's prosecution and relief on private sector and even public sector entities and the history of their going after entities for financial damages that allow breaches. Without objection, so ordered.
Mr. Chairman, can I get a copy of that?
We'll make copies available to all of you. It's all public information. And we did include both your Massachusetts Attorney General Vermont Attorney General and Maryland Attorney General's actions on behalf of your constituents.
I appreciate that. Thank you.
Members may have 7 days in which to submit opening statements for the record. We now welcome our witnesses today. Mr. Gregory Wilshusen is the Director of Information Security Issues at the Government Accountability Office, and the subject, obviously, of some frustration before he got here today. Ms. Marilyn Tabner is the Administrator for the Center for Medicare and Medicaid Services at the Department of Health and Human Services, thereafter called CMS today. Ms. Ann Barron DiCamillo is the Director of the U.S. Computer Emergency Readiness Team at the Department of Homeland Security, hereafter probably called CERT. Pursuant to the committee rules, all members are to be sworn. Would you please all raise your right hands to take the oath? Do you solemnly swear or affirm that the testimony you are about to give today will be the truth, the whole truth, and nothing but the truth? Please be seated. Let the record reflect that all witnesses answered in the affirmative. In order to allow sufficient time for your panel and then what I suspect will be a robust series of questions, I would ask that you limit your opening statement to 5 minutes, although your entire statements, including additional information that you may want to make available, will be placed in the record. So, Mr. Vell, you see, without my talking point, it's really hard. Wilshusen, please continue.
Thank you, Mr. Chairman. Chairman Issa, Ranking Member Cummings, and members of the committee. I am pleased to be here today as you examine the implementation of the Patient Protection and Affordable Care Act. As you know, the Act requires the establishment of a health insurance marketplace in each state to assist consumers and small businesses in comparing, selecting, and enrolling in health benefit plans offered by participating private insurers. CMS is responsible for creating a federally facilitated marketplace for states that do not establish their own. This marketplace is supported by an array of IT systems, including healthcare.gov, the website that provides the consumer portal to the marketplace. My statement today will summarize the key findings from our recently issued work on the security and privacy protections of the systems supporting healthcare.gov. But before I proceed, Mr. Chairman, if I may, I'd like to recognize several members of my team who are instrumental in protecting and performing this work. With me today is John DeFerrari, Marisol Cruz, Justin Polk, and Mark Cantor. In addition, members from GAO's eSecurity Lab also participated: Lon Chen, Wes Coyle, Duck Noll, and Michael Stevens.
Could you all please stand so that we can all, at least for a moment, realize your contribution? Thank you. You may continue.
Thank you. Healthcare.gov related systems, including the core systems of the federally facilitated marketplace and Federal Data Services Hub, represent a complex system that interconnects a broad range of federal agency systems, state agencies and their systems, and other entities such as contractors and issuers of health plans. The complexity and interconnectivity inherently introduces risk. Ensuring the security of such a system poses a significant challenge. To meet that challenge, CMS has undertaken a number of activities to enhance the security and privacy of systems supporting healthcare.gov. For example, CMS has developed and documented security-related policies and procedures. It developed a process for remediating identified security weaknesses. CMS also created interconnection security agreements with the federal agencies with which it exchanges information. And it instituted certain required privacy protections, such as notifying the public of the types of information that will be maintained in the system. However, CMS did not fully or effectively implement key technical security controls to sufficiently safeguard the confidentiality, integrity, and availability of the federally facilitated marketplace and its information. For example, CMS did not always require or enforce strong password controls, did not sufficiently restrict systems from accessing the Internet, and did not consistently implement patches in a timely manner. CMS also had shortcomings in its information security and privacy management program. For example, system security plans for the federally facilitated marketplace and data hub generally contained most required information, but each plan was missing key security information. CMS had also undertaken a series of security-related testing activities that began in 2012. Yet these control assessments did not fully identify and test all relevant controls prior to deploying the systems. In addition, CMS did not fully assess privacy risk and its privacy impact assessments, and had not fully established an alternate processing site for healthcare.gov systems to ensure that they could be recovered in the event of a disruption or disaster. To assist CMS, we made 6 recommendations addressing the shortcomings with this information security and privacy program, and 22 recommendations to resolve technical security weaknesses related to access controls and configuration management. CMS concurred or partially concurred with all 28 recommendations and noted that it was taking actions to address each of them. In conclusion, while CMS has taken important steps to apply security and privacy safeguards to healthcare.gov and its supporting systems, weaknesses remain that put these systems and the sensitive personal information they contain at an increased and unnecessary risk of compromise. Mr. Chairman, Ranking Member Cummings, and members of the committee, this concludes my opening statement. I'd be happy to answer your questions.
Thank you. Ms. Tavner, please. Thank you.
Chairman Issa, Ranking Member Cummings, members of the committee, thank you for the opportunity to be here today, and I want to make everyone aware that CMS strives to be as responsive as possible. I understand that we have already provided over 140,000 pages of documents to this committee. Transparency is important, and that's why I'm pleased to be here today and have the opportunity to answer your questions, and we will continue to produce documents. In the almost 5 years that I've had the privilege to work at CMS, my focus has been on how we can best serve our beneficiaries, including seniors on Medicare, adults and children on Medicaid and CHIP, and consumers enrolling in the marketplace. When I come to work each day, I work to expand coverage and competition, reduce cost, improve quality in ways that make a difference in people's lives, and we're making real and important progress. As of August 15th this year, we have 7.3 million Americans enrolled in the health insurance marketplace coverage, and these are individuals who have paid their premiums. We're encouraged by the numbers of consumers who have paid their premiums and continue to enroll in the marketplace coverage every day through special enrollment periods. This is the most recent count of people who have coverage throughout the marketplace. Each month, this number will change slightly as consumers transition in and out of coverage as their life circumstances change, everything from getting a new job to moving to a new state or becoming eligible for Medicaid or Medicare. There's also good news about Medicare. Spending per Medicare beneficiary is growing slower than the overall economy. The Medicare trustees recently projected that the trust fund that finances Medicare's hospital insurance coverage will remain solvent until 2030, 4 years beyond what was projected just 1 year ago. We strive to make health care safer and better. In the last 5 years, we've seen a 9% reduction in harm in hospitals, such as decreased health care-associated infections. This represents over 500,000 injuries, infections, and adverse events avoided, over 15,000 lives saved, and approximately $4 billion in avoided cost. This adds up to better health care at a better price, and I know that makes a real difference for real people. Consumers also trust us with their personal information, and I take that trust very seriously. Security and privacy are one of our highest priorities. CMS has decades of experience in operating the Medicare program and its supporting systems, and we successfully protect the personal information of both beneficiaries and providers. However, we must continue to be vigilant and evolve our assessments and actions to keep up with ever-changing threats. Consumers can use the marketplace with confidence that their information is safe and take comfort in knowing that no personally identifiable information has been maliciously accessed from the site. Our systems are designed with security in mind, and our focus on security is ongoing. It did not end when the marketplace launched. CMS conducts continuous monitoring using a 24/7 multi-layer professional security team and penetration testing. Our systems comply with FSMA and standards promulgated by NIST and the Office of Management and Budget. There is risk inherent in any system. It is simply, sadly, a part of the cyber world in which we all live. We appreciate the work done by the GAO to suggest additional controls to help us further protect against these risks and are always seeking to improve upon the security protections in place. As we look forward to our second enrollment period, our goal is to build upon this progress and to address outstanding challenges. We're working to make it as seamless as possible for people to re-enroll in coverage and reinforcing our outreach to help more uninsured consumers enroll in coverage. We're making management improvements with clear accountability and are committed to being transparent. This coming year will be one of visible and continued improvement, but not perfection. As problems arise, we will fix them, just as we always have. Throughout my career as a hospital executive, nurse, and public servant, my focus has been on providing people with high-quality health care. I'm proud of the progress we've made at CMS, and I hope to continue to work with Congress on our efforts. Thank you.
Thank you. Ms. Barron DiCamillo, is that closer? Okay, I'll try to do better. Thank you.
Start again. Chairman Issa, Ranking Members Cummings, and members of the committee, thank you for the opportunity to appear before you today. We are also making every opportunity and every effort to be transparent at DHS, to be as transparent as possible. My name is Ann Barron DiCamillo. I'm the Director of U.S. CERT within the National Cyber Security and Communications Integration Center, also known as the NCIC. We lead the Department of Homeland Security's efforts in cyberspace to respond to major incidents, analyze threats, and share critical cybersecurity information with trusted partners around the world. U.S. CERT is a 24/7 operations center and receives and analyzes hundreds of incidents reports a day. We work with public and private sector partner organizations and are committed to the protection of privacy and civil liberties for all Americans. At U.S. CERT, we strive for a safer, stronger Internet for all Americans. Established in 2003, U.S. CERT initially focused on securing U.S. federal systems and networks. DHS's cybersecurity capabilities have grown immensely since the establishment of U.S. CERT, and we are working more closely than ever with partners across public and private sectors to develop a comprehensive picture of malicious activity and mitigation options. Cybersecurity is a shared responsibility and a continuous process. Our focus is helping our partners build a resilient and secure ecosystem in cyberspace. Protecting our networks requires coordination across a global cyber community to enhance others' capabilities as we continue to mature our own. While DHS leads the national effort to secure federal civilian networks, agency heads are responsible for assessing risk to their systems and taking appropriate measures to secure their networks. U.S. CERT supports agency heads and chief information officers in carrying out these responsibilities. I'm here today in a technical capacity to provide findings from our analysis of the compromised test server at healthcare.gov. U.S. CERT was notified of an incident by CMS, who has the oversight responsibility of healthcare.gov. We conducted analysis of the images provided to us by CMS and found evidence of malware on a test server. As stated by Ranking Member Cummings, our analysis concluded that there was no indication of personally identifiable information, also known as PII, exposure, and no indication of data exfiltration. Additionally, there is no evidence of any lateral movement within the network or further infection. We provided CMS a report with these findings as well as mitigation recommendations. Additionally, we were able to share indicators from our analysis so that agencies, partners, and stakeholders could better protect their own networks. We are currently in discussions with HHS to provide further on-site support. DHS remains committed to working with its federal and private sector partners to create a safe, secure, and resilient cyberspace. I look forward to answering any questions that you might have.
Thank you. I'll start with you then. When did you find out you were going to appear here today?
I believe I was informed on Monday.
And when did you begin preparing for today's hearing?
And when I was informed on Monday.
Okay. Has CERT done a security testing of healthcare.gov?
We were provided images from CMS of the compromised test servers, and we provided analysis.
I appreciate that. The question was, has CERT conducted any security testing of healthcare.gov's vulnerabilities?
No. As I stated in my opening remarks, we
So when Ms. Tavner says there have been no loss of personally identifiable information, if you don't know the vulnerabilities, how do you know that? How would she know that to be true?
I believe that CMS conducts their own scanning and testing, but I'm happy to.
Did you verify their scanning and testing to be sufficient?
We would be happy to provide that information.
Did you?
I haven't been provided any details on those scans.
So you don't know that?
Within the test network?
Yeah, look, it boils down to, you're here as an expert that I didn't expect from an organization that refused to give my staff any briefing related to it.
And I do apologize for that. I was under the impression that our staff was working with your staff to answer those questions, so I'm happy to answer.
No, as of yesterday afternoon, they put people who didn't have technical expertise on who told us they'd get back to us. That's after more than a week of information we've already put in the record where we were denied that. Maybe I'll go on to GAO. I'm going to ask, first of all, your indulgence. When this hearing is over, I would like you to accept the pardon me?
No, I told her no.
Oh, okay.
I wanted to hear what you had to say.
That can happen. I would like you to accept a briefing and do a supplemental related to the 13 breaches.
Okay.
Ms. Tavner, I'm going to presume that you will agree that he will have full access to all information related to that so that GAO may develop specific additional recommendations based on the actual breaches, if you will, the 13 incidents.
Yes, sir.
Okay. That will allow us to get what we don't have here today, and I appreciate that. But, Mr. Wilscher-Zen, You've gone through an extensive amount. Would you describe for the committee the level of cooperation you believe you got? We've heard what you didn't get. Are there some good news stories in the cooperation as you did your investigation or your audit?
Well, there are some good news and then some not so good news, Mr. Chairman. As we began our audit, and generally we do receive good cooperation from the agencies that we audit as it relates to receiving information requests that we provide. In this case, initially, there were delays in providing certain documents that we had requested. In addition, there were certain, CMS attempted to put certain restrictions on some of the documents.
Did they cite why they were restricting? Are you just not trustworthy?
No, I think they indicated that they were concerned about the security, the sensitive security information.
So they don't trust you?
I wouldn't say that, sir, no. But we elevated the issue within GAO and within the department, and we reached an agreement to where we would be able to, and they did provide the information for us to look at.
So at the end of it all, there was no reason, after it was elevated, there was no reason that they should have denied it to begin with?
In my view, no. They should have provided it earlier. But at the same point, they had a concern about the security of the information. So they tell us, but their motivation would probably be better addressed by the administrator.
Limited time, and I want to sort of set the stage for what others on both sides of the aisle may ask here. When you looked at the robustness of how they determine with such certainty that there have been no breaches, no loss of personally identifiable information, were you satisfied that all those procedures were robust enough that with the certainty that Ms. Tavner said that no losses had occurred, that no losses had occurred?
Well, we did not receive actual security incident reports on these incidents, at least on the 13. We did receive a written response to an interrogatory in which they indicated that, or at least for the 13, that there was certain PII that was compromised or disclosed to an individual, but it was a consumer. It was due to a technical glitch.
Well, I understand. So
right.
Personally identifiable information was lost or disclosed?
Was disclosed according to their description.
Okay, Ms. Tavner, others will ask additional questions, but your opening statement said none had been lost. How can we reconcile none has been lost with a sworn statement that some has been lost?
I think what my statement said is there were no malicious attacks on.
So if you just screw up and put the public's information out there, it's okay because it wasn't a malicious attack?
No, sir, I don't think anytime we put consumer information out there, it's okay, but I think.
Okay, so my time has expired, and I want the ranking member to have full time. I just want to make it clear that wordsmithing of no malicious was done versus accidental, just as we discovered at the time of the launch, that if I went to the section above, where the URL normally is, when that thing was launched, if I simply typed in a different number or a different state code, I could have looked at somebody else's record. That was part of what you guys had wrong on the day of the launch, is that you could simply go to somebody else's record by changing that long streak at the top, meaning no code. That wouldn't have been malicious, I guess, except that if somebody were doing it to see what they would get, that would be a little bit malicious. So when you say no personally identifiable information was lost through malicious, what you are saying is you don't know how much was lost, you just believe that the definition of malicious wasn't met. Is that right?
I actually, and I think this relates to the personal incidents, and I do think that we want to cooperate with the GAO on that, and we're happy to review those. And I think
Thank you. Your desire to want to cooperate after we bring you here involuntarily for a hearing is most appreciated, but quite frankly, you should have cooperated with the GAO beforehand.
Sir, I think I always like to cooperate with the GAO and the OIG, and we've had over 140 open audits underway, and I think we have cooperated. I'd also like to say I came here voluntarily.
Thank you. Mr. Danny?
Wait.
Oh, Lacey? The distinguished gentleman from Missouri is now recognized for 5 minutes.
And thank you,
Mr. Clay.
Chairman. Thank you and thank the ranking member for yielding his time. Mr. Wilshusen, GAO found that healthcare.gov had security weaknesses when it was first launched, in part because of a lack of adequate oversight of security contractors. Is that right?
We found that with respect to when it was first deployed, and recognize that our audit occurred subsequent to the initial deployment, we found that based on a review of the documents that there were certain vulnerabilities and controls that had not been tested at that time, and that there were a few vulnerabilities that had been identified through testing, through which the CMS had accepted in order to provide an authority to operate.
Whose responsibilities were incumbent upon the contractor, correct?
Well, overall responsibility, it rests with the service.
With the contractor, or?
I believe, was it the contractor? I think in some cases, there may be incidents where we did identify weaknesses that were operated on systems operated by a contractor, but that was subsequent.
Okay.
That was during the course of our audit, that doesn't necessarily pertain to prior to the system or to the deployment of the system.
Sure. And GAO report found that there was not a shared understanding of how security was implemented among all entities involved in the development and security testing of the website. Is that correct?
Yes, that's correct. And what we found, too, is that in certain instances where CMS told us who was responsible, the contractor that was responsible for certain tests, such as assessing or implementing security on a firewall, we went to that contractor. The contractor indicated that it was not his responsibility, that it was another contractor, and that responsibility was not identified in that contract statement of work.
Yeah, but scenarios like this obviously increase the likelihood of security risks. Is that correct?
Yes, sir.
And was there a specific CMS official or group that was responsible for overseeing the security testing of healthcare.gov? Is there a group?
Well, overall, the CMS, CIO, and Chief Information Officer and Chief Information Security Officer have, I would say, overall responsibility for reviewing and assuring the security over this system.
Now, for a project of this magnitude, shouldn't an agency official with a broad understanding of IT security testing oversee contractors?
I would say yes.
And was that the case here?
I would say that, there is, the CIO, CISO would be the individuals that would have that responsibility overall.
Okay, so who would the CMS official be that would have that kind of understanding of IT security testing? Was there a person in place?
Yes, they had the CMS CISO. In addition, there are several individuals that were responsible for aspects related to security over the healthcare.gov. There is also an information system security officer that has responsibility for assuring that security controls are properly implemented.
And the issues with IT security management did not start with healthcare.gov. As a matter of fact, this is a broader government problem that needs to be addressed, don't you think?
GAO has been reporting information security and federal information security as a government-wide high-risk area since 1997. And so sadly, yes, it's a broad government issue. There have been weaknesses. Just as an example, for fiscal year 2013, 18 out of the 24 major federal agencies covered by the Chief Financial Officers Act reported either a material weakness or significant deficiency in their information security controls for financial reporting purposes. 21 out of the 24 IGs at 21 out of the 24 agencies also cited information security as a major management challenge. So yes.
And so it would be fair to say that all Internet-facing systems, both in the federal government and the private sector, involve some risk. Is that correct?
Given the nature of the Internet and the capabilities and prevalence of hackers who might try to exploit vulnerabilities, yes, the answer is there is risk in conducting online transactions.
Thank you so much for your responses, Mr. Chairman. I yield back.
I thank the gentleman. We now go to the gentleman from Florida for 5 minutes.
Thank you, Mr. Chairman. And I have a copy of your report dated September 2014. And in that, you, in fact, state, and GAO found, first of all, I think you found that the testing was not complete, and the whole program was rolled out with weaknesses in security and protection of privacy. Would that be an accurate statement? Okay. I also see that you say that GAO report strongly asserts that testing of the website still remains insecure. Is that correct?
I would say that the testing of healthcare.gov and the supporting systems has not been comprehensive.
So even to date, we have risks. Is that correct?
Today we have risks.
Security risks, privacy, information risks. Okay, thank you. And there was the rollout there. They actually rolled this out, I saw in the report too. I guess 4 states had not even taken action to secure privacy.
I would characterize it more as they had not met CMS security requirements.
Security requirements, and we'll have those for the record, the states. So it's incomplete testing. Then I see basically a cover-up of the failure that took place. Did you see any of that? They were trying. I went through some of these emails and some of the record the committee has. I don't know if you saw this, but it looks like quite a cover-up, or they tried to not let the public know the failure of what the failure of the rollout and the failure of them to protect this information. Is that correct?
I'm sorry, I could not comment on that because I have not seen the.
Well, I can tell you, it's page after page. I mean, I can't even use some of the language used here. Mr. Chairman, I'd like to have some of this this submitted in
without objection.
This report.
The entire report we place.
Okay, it's astounding. Again, this is a blanking disaster. I mean, this is one of the HHS people who saw what was going on at CMS. Politico has a 2-day story that talks about the issues and most detailed explanation, but it's just stating overwhelming traffic that couldn't have been replicated in testing. I mean, just one point after another of what the cover-up. I think, unfortunately, people like Ms. Taverner were involved in some of the cover-up. Did you ever attempt, ma'am, to have any emails or records deleted to what was going on in the failure?
I'm not aware of the emails. I'm not seeing the emails you're responding to, so I can't answer that.
Well, I have one email here, and you had asked that it, in fact, be deleted. I can supply you with a copy of it, but it says, please delete this email. It goes on to detail what was going on, the failure that was going on. First of all, there was a company by the name of Serco that was employed to, or retained a contract of $1.2 billion. Is that correct, to process the paper applications?
We retain Serco. I don't have the amount in front of me.
Well, again, this email talks about Serco and the failure of the proper processing. There were problems with processing the paper applications.
Congressman Mike, I'm happy to take a look at the
And you had nothing
email.
to do with the awarding of a $1.2 billion contract, you would tell the committee too, right?
I don't understand what the question
Of the
is you're asking
Serco
me.
contract to process paper. Here you're talking
I'm
about...
actually not part of the
Here
group
you're
that selects
talking about
contracts.
Serco and the problems with the paperwork. You're asking for deleting of information. Then I looked a little bit into Serco, and the Serco scandal grows. Did you know that Serco had been awarded the contract, a $1.2 billion contract, while they were being investigated? It's a British-UK firm, and they were being investigated for some fraudulent activities in the UK as they were being awarded a $1.2 billion contract?
No, sir, I didn't.
You weren't aware
I think I
of
stated that last year in a hearing.
any of the background. Again, I think we need to put this, Mr. Chairman, I'd like to put this this email in the record where the witness asked that we delete this particular email, and it dealt with the problems with Serco at that point.
Without objection, so ordered.
Finally, are you aware that you violate federal law when you ask to delete information like this?
Again, Congressman, I would need to see the email.
Okay,
in
we'll
order to answer
provide the
question.
witness if we could. with
If
the
we'll
copy.
pause quickly, if you'll send it down to her, I think you might as well get it quickly done. I'd ask unanimous consent to stop the clock and give her an opportunity to read it. Thank you.
Just simply, is that your email, and did you ask to have it deleted at the beginning? It states pretty clearly your intention. Mr. Chairman, I'll defer to you to get a response from the witness.
This email is from me, yes, sir, that's accurate. And this email was written to Julie Bataille, who at the time was involved in the call center, and I think this is about the call center information. And I think that I asked that she delete this email because it involves sensitive information regarding the President's schedule, and I think that's actually the area that's redacted. But no, it is not normally my custom to ask. Sometimes I would ask that things be close hold or do not forward, but in this case, it involved the President's schedule, if I remember this correctly.
Mr. Chairman, I would also, I want the entire content of the email entered into the record and the reference further down to Serco. Thank you. Yield back.
Thank you. I'm just briefly, if I could have indulgence. why would the President's schedule after the fact have any relevance to being needed to be deleted? I hear you, but the President's schedule becomes very public in real time within a very short period of time.
So I can't answer the reason to why this was redacted. I didn't make the decision to redact it. That's done by our Oversight Committee.
But you were surmising that it had to do with the President's schedule. The President's schedule is not all that secretive, and after the fact, it has no relevance for protection.
I understand.
And under the Federal Records Act, your communication is to be retained, correct?
And it was retained. My immediate staff was copied on that, and that's why you have it. It was retained.
Okay. So deleting it doesn't change the fact that it had to be retained for the Federal Records Act.
It is retained. And in fact, if you are asking about our response to NARA, we did that out of an abundance of caution because we weren't sure, because I didn't necessarily retain some emails if they related to scheduling changes and this sort of thing. So going back to the issue of transparency and trying to be forthcoming about information, we decided to notify NARA.
Okay. I would hope that the unredacted versions of all this would be made available to the GAO, and I would ask simply that unredacted versions be seen by the GAO to see if, in fact, it's consistent with what we're hearing here
Mr.
today.
Chairman, a unanimous request.
Gentlemen,
I have articles about Serco scandal grows and people paid to do nothing in processing Serco's checkered past. White House hired sham foreign company for Obamacare, and a Forbes article, the unhealthy truth about Obamacare contractors. I'd like these to be.
Without objection, so ordered.
Thank you.
And with that, we'll go to the gentleman from Pennsylvania for 5 minutes.
Thank you, Mr. Chairman, and thank you to the witnesses for joining us here today.
Yeah, I'm good with that. I'm good with it, yeah.
And one of the most critical features of the Affordable Care Act is that it expands Medicaid eligibility to millions of low-income American adults. Prior to the ACA, Medicaid eligibility was restricted primarily to low-income children, their parents, people with disabilities, and seniors. In most states, adults without dependent children were not eligible for Medicaid. According to a study issued in April 2014 by the Kaiser Foundation, only about 30% of poor non-elderly adults had Medicaid coverage in 2012, and uninsured rates for poor adults were more than double the national average. Under the ACA, Medicaid eligibility can be expanded to cover all non-elderly adults with incomes below 138% of the federal poverty level. Administrator Tavener, is that correct?
Yes, sir, I believe that is correct.
All right. So the Federal Government pays states 100% of the costs for the first 3 years and then phases that down, phases its match down to about 90% in 2020. Despite this enormous level of Federal assistance, more than 20 states have decided not to participate in the expansion, leaving millions of their own citizens without health care. Administrator Tavener, can you comment on the coverage gap that is resulting from these decisions not to expand Medicaid in those states?
Yes, sir. I would start first by saying with Pennsylvania's recent decision, we are now at 27 states, I believe, plus the District of Columbia, who've decided to expand Medicaid. And obviously, if you look at a lot of independent studies, there's noticeable difference in the states that have decided to expand Medicaid in terms of lowering the number of uninsured. We're going to continue to work with those remaining 20-something, and we meet with them on a regular basis to do what we can to encourage folks to expand.
Now, by not participating, aren't the states that aren't leaving billions of Federal dollars on the table that could be used to improve the health of their own citizens?
Yes, sir, they are, and it's also has economic consequences for those states as well.
Of course. Now, recently, some Republican governors, as you've alluded to, who had originally refused to expand Medicaid, have now reconsidered their original decisions and have submitted Medicaid expansion plans for CMS's approval. For instance, in my own state of Pennsylvania, as you mentioned, they decided to expand Medicaid, which will now provide health insurance to 600,000 low-income adult individuals in our state. Administrator Tavenner, how will Medicaid expansion in Pennsylvania impact the health of its citizens?
I certainly can get you information from independent studies, but there is a definite correlation between coverage of insurance and long-term health improvement.
Good. Now, and I don't want to leave this question out. Other than political posturing by the Pennsylvania governor, are you aware of any good reason why 600,000 good Pennsylvanians went without coverage for an extra 9 months from the rest of the states that expanded Medicaid right away?
No, sir, we want everyone to expand and expand quickly.
Well, Administrator Tavenner, why do you think Republican governors are so divided on the issue of Medicaid expansion?
Sir, I can't answer that. I'm not sure. I'm sure each state has their reasons. We just try to work with them and meet them where they want to be.
All right. Do you expect to work with additional governors who previously opposed Medicaid expansion but are now considering reversing their decisions?
Absolutely.
Well, I want to say I thank you for coming here today, and I thank you for your testimony. I hope that governors in states that have so far not elected to expand Medicaid will reconsider, will consider the impact on their communities to take advantage of this historic opportunity to lift up all of the Americans in their states as well. Thanks again, Administrator Tavenner, and I yield back.
Would the gentleman yield? Oh, okay. Well, at some future time, I'm happy to work with you and explain Republican governors to your satisfaction. With that, we go to the gentleman from Utah, perhaps a man that will someday be a Republican governor, for 5 minutes.
Reclaiming my time. Thank the Chairman, and thank you all for being here. Ms. Tavenner, question for you about the Oregon exchange. The American taxpayers put in some $304 million to develop that state exchange. Now they want to come over and make a transition. Did you or anybody at CMS conduct a cost-benefit analysis to determine that the switch to the Federal exchange was the most cost-effective for the taxpayers?
Yes, sir. We did an analysis of what it would cost for us to bring in. There's 2 additional states we're bringing in this year, Nevada and Oregon. And we did, I wouldn't say it would be a sophisticated analysis, but we did a cost analysis. And as you might imagine, we already have 36 states in the exchange. Adding 2 more is cost-effective.
Could you share that analysis with us? Is that something you could provide to us?
Certainly.
What is the additional cost?
I don't have that in front of me, but I'm happy to get it for you.
When's a good time? When would I raise the flag and say, all right, that's been long enough? Can you give me a sense of the time? I'm sorry.
Right. We should be able to get you that in a few days.
Oh, okay. Very good. Thank you. I appreciate that.
It's part of our bill that's ongoing.
A few more questions about that. What's being done to claw back? I mean, there's $304 million. Is that money all gone? Is there some of that coming back? Is somebody going to jail? What's going on with it?
So each state, and again,
I want to talk specifically about Oregon. That seems to be the most egregious.
I think Oregon has very actively gone after their contractor, and I think that's been in the press. But I'm happy to get you more details.
But what's the Federal government doing? It was Federal taxpayer dollars, correct, that went into it?
Yes, these were actually grants awarded to states, and so the contract is between the state and the contractor, so the states were working that initially.
CMS, Health and Human Services, Department of Justice, the Federal Government, I mean, pick your entity. We're doing nothing to claw those back, claw back those dollars?
Ultimately, I think it's a little early in the decision-making right now. States are going after it on the basis of their individual contracts.
But the federal taxpayers give $304 million, and we just say, well, it's up to Oregon to figure out what to do.
We're obviously working with the state.
When we gave these grants, was there no condition or expectation that it would work? I mean, was there a deal that said that we just literally hand them over the money and we don't care what happens? I mean, it ultimately didn't work, correct?
What we did are a series of progress reports and requirements with the states, and I'm happy to get you that information as well.
I'm just trying to get some degree of specificity. I haven't heard you yet say we're doing something to try to claw back nearly a third of $1 billion of dollars.
I think what I've said is that states are doing that right now, and we're cooperating with states.
And so, but where is the federal government not doing anything?
We're cooperating with states. The contracts between the states.
So we're just waiting for Oregon to tell us something.
We're working with Oregon and other states. That's all I can say right now.
And Mr. Chairman, I mean, I don't know how.
That's what she said. It's all she's going to say. She won't answer your question.
I know. I just think it's something that the Congress legitimately should look at. We give out $300+ million, and we just call it a day and move on. Ms. Tavenner, is there any criteria or guidance for states who want to drop out and move to our exchange? Have you issued, or how do you evaluate those, or do you just say yes?
Well, we obviously have a list of criteria and requirements for the state to move from a state-based exchange to move to the FFM. These entities stay state-based exchanges. They can continue to do their marketing, their outreach. What we are doing is the FFM support, and there are criteria they have to meet for us to move them back into the system, and I'm happy to share that with you.
Okay, so you can, in that package?
Yes, we
yes,
have
in
that.
a few days you'll share that with me as well. I appreciate it.
We have a lot of documentation.
Yeah, okay, thank you. I appreciate it. And again, for my colleagues here, we really have to look at this. It's stunning to think that we would hand out by the hundreds of millions of dollars to states and have no recourse. And if it doesn't work, we just kind of throw up our hands and say, well, it's up to somebody else to figure it out. That's not the way we should operate. It's pretty stunning and very dissatisfying, and doesn't produce results. It's not responsible. It's not accountable, and very frustrating. I yield back.
I thank the gentleman